Hello, today I want to show you some exercises for retained primitive reflexes, or if the reflexes has never started. Babies need to have certain reflexes and they're important for survival when they're born. But these reflexes have to gradually start going away by the age of 1 year. They'll start at different times. They should all be done at the age of 1 year. If they do not resolve or they do not diminish after 1 year, there could be some developmental delays, mostly when they're experiencing posture or mental delays, or cognitive delays, or emotional or relational delays with this as well. So when we check these at the beginning, when the baby comes in, this is what we check for. So there's 3 different exercises that I'm going to show you in this video, and they're very similar, just in different parts of the body. One's going to be a rooting reflex. So this is if your child you stroke their side right here, and if they're really an infant and they're not doing this, if they're having a hard time nursing, this is something that I would check, okay? And they should just kind of squig or kind of turn their head. If we're doing it with their hands, we don't want to see this after 1 year of them going like this. So some kids with that are having this will have some other problems usually have some other problems going on. But they should have a really tight grip by the age of like 1 month, or right when they're born. They'll have a really tight, babies really have a really grip, and that's for grabbing onto things as well. Okay, and then even in the foot, when we do the foot, we're going to go around the outside of the foot, and the toes should splay out in the beginning, right when they're born. We've seen this before, but gradually we want the toes to start pulling back like this. So some exercises to do that I would show you if I start seeing these reflexes in the office I'm going to show you now. So when we start doing this, we're going to do it on Brucey, okay? Bruce is our dowel that we demonstrate on. So if there's a rooting reflex on this side where it's retained or not showing up, the stroke is just going to be like this. You can use a Q-tip, works great. A light finger works wonderful as well, but just get something that's nice and soft. And they might start doing this. They might start really kind of crinkling their face or squinting their eye a little bit. Your child might do this, but over a period of time, we want to keep doing this. Or what happens is we'll keep doing this, and it might be a month or so that this is still going on, but you notice they're starting to become better. They're starting to move better, or they're starting to nurse better, but they still have this reflex. You got to keep doing it. It's a matter of sometimes you just don't know what day is going to happen. You just know that the process is going to work. Same thing with the hand. We want to do with this hand. I'm going to show you. With this, we're just going to go up and stroke. And what happens is the kid will be like this. So go up this way, then stroke across. Up, then stroke across. So we're going to go up the hand, then stroke across. Each one of these should be done for 30 repetitions. 30 times. Should be done 3 times a day as well. With the foot, we see the foot, and this is if the foot's not splaying out or not moving at all when they're born, or if it's still doing that by the time of 1 year of age. We're going to start going like this in an S pattern. And again, they'll start splaying their toes out, but maybe a course of, and they might start walking better. Kids with this will have issues with walking, or maybe even starting to crawl. We'll start to do this. So those are 3 reflexes that we can do with the rooting reflex, which is with the cheek, the palmar reflex, or the palm, right, with the hands, and the plantar, or the foot, we're going to do in this pattern like an outside or reverse 7, up along the outside and then across towards the middle of the foot. Again, if you have any questions about this, or you know if you're not doing this right, please let us know. We'd be happy to show you. If you're not a patient, give us a call. We'd be happy to help you as that as well.